In other news, saving lives during a crisis requires preparation and training. And today, that training brought a huge airplane to the Spokane International Airport. One viewer even called us today and asked if the president was in town. KREM 2's Rose Beltz was at the airport today to get a first-hand look at one of the government's most powerful tools to fight contagious diseases.
Things changed in 2014 when the CDC confirmed the first case of the Ebola virus in the United States. It was like a scene out of the movie Outbreak. A 42-year-old West African patient developed symptoms approximately 4 days after arriving in Dallas, Texas. American hospitals across the country have been preparing for the possibility of new cases.
When we have 4 patients, we have a total of 5 medical people in the box.
The largest patient transport exercise in U.S. Department of Health and Human Services history began today. More than 50 government and non-government organizations across the country are participating in Operation Tranquil Terminus, a lifelike international crisis and public health exercise that was designed to train health professionals and test the nationwide ability to safely treat and move patients with Ebola symptoms and other highly contagious diseases from community hospitals to pre-identified treatment centers.
We practice these types of operations so we're prepared to help Americans when disaster strikes.
2 seriously ill mock patients arrived at Spokane International Airport this afternoon. They were carried from Boise, Idaho by Phoenix Air, an especially equipped Boeing 747 medevac cargo jet, the same company that transported patients during the 2014 Ebola outbreak.
Transporting patients with severe, highly infectious diseases can be particularly challenging
because they have to be examined and treated in isolation. Then an ambulance protected with a plastic lining took these highly infectious patients to the Special Pathogens Unit at Providence Sacred Heart Medical Center and Children's Hospital. This unit is one of 10 regional Ebola treatment centers in the country. It serves Washington State, Idaho, Oregon, and Alaska.
That are especially equipped and capable of taking care of highly infectious patients.
Which she says is important in this day and age of globalization and travel.
You know, there are special pathogens in quite a few different countries throughout the world, and so I think it's really important for us in keeping our communities safe and our healthcare workers safe to have this capability and to be ready when whatever does come arrives.
Nurse Arganchona is confident that ongoing training and education like today will keep the area safe.
There have been no new cases of Ebola diagnosed since 2014. And healthcare professionals say that the likelihood of Sacred Heart receiving a highly infectious patient are probably low. But doctors don't know what kind of patients are going to show up in their emergency rooms. So having those policies, procedures, and that extra level of preparedness in place is essential for the community. I'm Rose Beltz, KREM 2 News.